Welcome back to Mornings on this Wednesday morning. I hope you're having a good day so far. Well, you know, the combination in this country of our very, very harsh climate, also growing pollution levels, and the natural ageing process really takes a toll on us, especially our faces. So this morning we're looking at ways to try and stop the clock, combat those signs of aging and dark circles, various treatments, the latest advances in the world of the cosmetic surgery world, perhaps, and Dr. Anoop Rastogi joins us. Good morning, Anoop.
Good morning.
Well, I tell you, now you got everybody's attention here.
Indeed.
How long before we actually do turn into our mums?
To our mums. Good question. And you know, and it certainly happens depending on how much you look like your mum, but it varies, and with the things that we've got available today, it's really up to the individual how quickly or how long it's going to take for them to turn into their mum.
Well, we've got a bit of a morphing process that we want to actually have a look. So if we start this, and you can just explain how it's working. Now, obviously, you're a very handsome young man.
Oh, indeed.
Now, as we age, it's happening slowly.
Yep. We can see what changed with a man particularly in here. What you can see is that lovely soft skin that he had to begin with turned into darker skin with skin pigmentation that comes from...
Can we start that again? Let's just do that aging process.
There we go.
Here we go. Okay, so he's got, you know,
nice gentle skin there. Big smile, alive eyes. You can see that he's getting those sun damage changes. Then he starts to get jowling, and he starts to get a thick neck. Lots of lines and wrinkles across his forehead. His hair goes grey, that we know. And so that's a little morph that kind of gives you an idea.
I'm glad they didn't choose me for that. I'm very, very grateful for small mercies. So quite naturally, our skin, let's talk about the quality of our skin. And I did mention our climate, because sun is the worst aspect of aging.
Absolutely. In fact, the number one cause of aging is smoking. That's the one that accelerates it. That and sun are the two huge ones, particularly in Australia. Luckily, Australia versus Europe, we've really got the smoking message in Australia. Europe still hasn't got it, but we've got the harsh climate, and so that does it.
So what we want to look at this morning is how we, you know, the grey hair can be, you know, there's the obvious answer there, but the lines, the jowly neck as we age, and the quality of our skin. And we've also got some celebrity pictures here. Maybe you can walk us through through these. We'll start with Jennifer, Jennifer Aniston.
Can we go back one? We've got a lovely young face that I'd love us to have a look at, and I'll walk you through these just to show you how the face ages. If we look at this, this is a beautiful young model, and you can see her eyebrows are high, her eyes are open and inviting, there's no bagging underneath her eyes. If we look down to the sides of her nose, there's a lovely clear, gentle fall from the cheeks to her top lip. She's got full lips. If you look at her jawline, it's nice and clear. So that's how we see
youth.
That's youth. That's young teenage beauty. Look at Jennifer Aniston, beautiful woman. Her, if we have a look at how the face ages, and granted, when we're looking at celebrities, we're looking at people who are maintaining themselves and doing little things, but let's just look at the process a little bit. Her eyebrows are still high, so the top part of her face is doing fine. Coming down, her eyelids looking good. You can see her cheeks are just starting to descend a little. We're starting to see some creases from the side of her nose to her mouth.
She's 30-something. Give her a break.
Yeah, no, she's doing brilliantly. She's doing brilliantly. Nasolabial folds, which are those creases on the sides.
From the nose down the outside of the mouth.
That's right. And that's probably the most important thing that we can see in Jennifer. If we click on and have a look at some of our other celebrities.
Sharon Stone.
Sharon Stone now.
Come on, that's airbrushing.
Oh, and that's the thing. A lot of these photos have that in it. If we look closely at Sharon Stone's photos, you can see some lines on the side of the mouth. Now, as the skin starts to relax, when one smiles, you're starting to get those fine lines appearing on the cheeks as the epidermis, the top layer of the skin, thickens with age, and the deeper layer, the dermis, thins with age. We see that more crusting appearance and the lines. We look at Elle Macpherson, who we all know is gorgeous, one of our Australian icons, and again, looking great here. You can see the eyebrows start to come down a little with age. She's got some fine lines and wrinkles around her eyes. Nasolabial folds, which is the side of the cheek coming down to the mouth, is getting that little bit heavier, and some fine lines. Now, these are not criticisms. This is what if you look at Elle 20 years ago, you won't see these, you'll see them now. Do I think she looks better now? You know, I think women look beautiful as they become more mature, because you've gone from that...
There's ways of not looking as they say, people keep telling me I look tired. You know,
Yes,
you must
exactly.
hear that all the time. And
Exactly.
you're never going to go back to what you were 20 years ago,
No.
but you just don't want to look any older. Now we've discussed the skin thickens, we get, you know, freckly type thing, all that makes. What do we do about it?
The solutions are luckily fairly straightforward. The first thing is prevention, and that's how do we stop that process? How quickly can we look like our mum? It's the prevention stuff that we do, and the basic things of those are still the main things that we do.
Okay, what about the quality of skin?
Okay, well, first thing is genetics, and genetics we can't change. So people with very fair skin and red hair, we know they have the least amount of protective pigmentation in their skin. They'll burn easily, they will get sun damage quickly. So they're the ones that are at first risk. People who have more oily skin, thicker skin, tend to age better. So then if we go beyond what genetics gives us and we look at the way that we look after ourselves, as we said before, not smoking. Smoke contains carbon monoxide and also nicotine, both of which constrict the blood flow to the skin and reduce the oxygenation and cause aging and free radical damage.
Cosmetically, in terms of cosmetic surgery or topical things, what can you do to the quality of your skin?
Okay, well, cosmetically we've got lots of stuff that we can do.
Which are?
Once we're taking our antioxidants and other things, then we can look at Botox around the eyes, brilliant to stop the eyebrows descending, stopping those lines forming. Some fairly groundbreaking research from the Archives of Dermatology, a dermatology magazine that's just produced a scientific article that shows that when we put things like Restylane and other hyaluronic acids in the skin, which are our common dermal fillers now, they actually stimulate collagen production, and they change the cellular environment to a more youthful environment where there's microhormones that maintain a youthful skin.
So the quality of skin. Okay, the dermal fillers that we're hearing so much about, they're the ones that can actually fill around here?
Yeah, that heaviness that we're seeing on the sides of the nose can be improved with that. The jowling on our jawline, we've got injections that can now
So injections, not surgery?
No. So far we're talking completely non-surgical.
Okay.
So we can dissolve away the fat on the jawline, we can prop up the cheekbones with fillers that now give us a cheek augmentation, and really just return that fat back to the face that's been lost
in the right
aging
places.
process. In the right places.
So instead of it falling from here to here, you move
We're
it around.
putting it back.
Cannot let you go without telling us about the dreaded dark circles.
Okay. Love to show you a picture of what we're talking about here. So if we look at some dark circles under the
you know, there are
eyes.
certain ethnic backgrounds which this is a really big issue with, let alone if you've had a hard night.
Exactly. If we look at our before and after photograph here, this is a patient of mine who you can see has some darkness underneath her eyes. Now, hers is caused because she's got slightly sunken eyes and she has a prominent bony ridge, which a lot of people have. It's called the nasojugal fold or the tear trough, and it throws a shadow that gives you dark circles. If you have veins that sit prominently, and a lot of people do, just underneath the eye, it produces that dark colour. And as you said, people from the Mediterranean or Middle Eastern parts of the world, increased pigmentation there causes an issue for us.
So what do you do about it?
The simplest and easiest thing that we have now is, again, completely non-surgical. We fill in that bony tear trough.
With what?
With a hyaluronic acid, Restylane, Perlane, something like that, that fills it out, moves the skin away from the veins and takes the depth of that circle out to give you, like we saw in that photograph, much brighter eyes without bags.
Okay, and that's not a surgical, that is just, you know, only
Then
takes
surgery
half an hour.
now we do without scars, taking the fat out from under the eyes.
So the baggy under the eyes, which is different to the dark circles, you take those out?
Yep.
Okay. Very good. Okay, now we've got that. Any of the information, just go to our website. We've got it posted there. But Anoop, thank you very much.
A pleasure, Kerri-Anne.
Dr. Rastogi joining us. We've got more coming up. Here's an idea for you.